Yes, I have a knowledge and idea about the tuberculosis being infectious and a fatal disease. I know about it.
I think so because it has something to do with coughing. So like lungs are connected to coughing because like I think it affects your breathing as well. Yes, I think TB is one of the major issues in Pakistan because I think a lot of people in Pakistan die because of TB because it's not cured or it's not taken care of properly.
It must be a health problem. It's not a major issue. Issue is people are not well aware of this disease. The moment they hear the word TB, they think that's it, that's the end of it. It's a life-threatening disease. This is something which one should work on. This is an issue. The people should be aware of it. They should be given proper. The doctors should be, they should give them proper guidelines and how to deal with the patient and not to panic.
Myths about TB that yes, most of the people think that there is no such thing as TB, and they basically believe that tuberculosis is not fatal, it's not deadly, it's just a normal cough, and it may be a viral infection, and they basically believe that TB is not contagious.
Not any misconceptions, but I do know that people cough a lot, and I don't know if it's true. If it's like something that is actually not a misconception, that is like something that has to do with the disease. But yeah, that's what I've heard. Like people cough a lot when they have TB. Not really, not really. I don't think so. I think there are a few hospitals that specializes in dealing with TB. Like government hospitals, I think जिन्ना इनका कोई TB का ward है या कुछ है, but I don't know any specific NGO or a government department that runs there. Like their main focus is TB.
Specifically in my area, being currently right now I'm living in Karachi, there might be many NGOs, but in person I don't know. But yes, if you talk about Islamabad and Wali, we do have private NGOs that have been working in this regard, and they are providing free treatments to the people who suffer from tuberculosis, and they are kept in much cleaner environments, and they are being provided with free healthcare.
They should work on teaching people about the diseases. Like I told you, this disease, if it's only affects the lung, then it's a contagious disease. But when I say contagious means you don't have to treat the patient like an untouchable. It's not necessary you have to keep him in complete isolation. The person who is diagnosed, sure, the doctor has to give him proper guidelines, how to take care of his hygiene, his surroundings, so the people around him are not affected. Secondly, the other type of TB which I have come across, somebody in my family which I got to know about, is intestinal TB. Now that is not at all contagious. But then I even come across such people who didn't want to go for the test because they were scared. What if the patient is diagnosed with TB? What will they do? No. You have to teach them. Doctors have to tell them it's okay even if they're diagnosed. It is, I think, in few patients it's a 6-month treatment, in few patients it's a 9 months treatment. And if Allah wills, one can be completely cured. So that is where I feel the students should work on spreading the awareness of the disease in this way.
For me, like students working on an issue regarding tuberculosis is a very bright idea. People should know about deadly diseases that are spreading on day-to-day basis, and students, because they are the future generations, and they basically are the people who can spread awareness in a positive way. And if they actually go and get the knowledge of what exactly tuberculosis is, or how deadly diseases can be prevented, or what could be done in order to save the rest of the population which is not suffering from tuberculosis, is a good idea. So definitely I appreciate this initiative from my students, and I wish them best of luck.
I think it's really good and it's like a positive thing to do since you are aware, like starting an awareness campaign about a disease that has already infected a lot of people in Pakistan. So I think it's like what I expect out of it. I expect out of it that like the awareness, like we can go up till like we can spread the maximum awareness as much as we can because students have like they can reach out to a lot of people. They can reach out to the teachers, like their parents, their grandparents, their relatives, and everyone. So but they can spread out the maximum awareness, and then I think it's going to be it's not even going to cost a lot. Like if you talk about cost, so I don't think it's going to cost a lot because the word of mouth is what is going to play the major role.